Good afternoon, and thank you for joining us for today's webinar. My name is Rachel Logan, the Training and Technical Assistance Manager at North American Management. At the National Center for Health and the Aging, we have a national cooperative agreement to provide training and technical assistance to health center programs serving aging populations. And we do this in multiple ways, including events such as today's webinar. So today's webinar is based on prostate cancer prevention, and our speaker today is Tom Kirk from US2. He's the president and CEO, and he joined US2 in November of 2004. He has also worked at the national level in various organizations such as Life Care Centers of America, United Way, and also has a background in social work. He holds a master's degree from the University of Wisconsin-Madison School of Social Work and currently resides in the Chicago suburbs. So after today's webinar, attendees will be able to summarize prostate cancer incidence information, list some of the challenges to prevent prostate cancer, and also identify those at risk, such as African Americans. Some brief facts before I turn the presentation over to Tom. African American men have the highest rate of prostate cancer in the U.S., or the highest incidence rate. And they also are more likely to die, have a high mortality rates from prostate cancer as well. And so this just represents the health disparity that we see in the U.S. Also, prostate cancer risk increases by age. And this diagram or chart shows that as men age, they also are more at risk. And so reaching those populations before they reach those crucial ages is important for healthcare providers to understand. Some barriers to screening and diagnosis among African American men include low socioeconomic status, a lack of health insurance coverage, which hopefully with the ACA and marketplaces we'll be able to get more men covered so they'll have access to screenings and things like that, as well as absence of ties and a relationship with a primary care physician. So those are some things that we want to just be thinking of as we listen to Tom's presentation. So Tom, I'll go ahead and turn it over to you.
Okay, great. Rachel introduced me, so let me just say that I've been here at US2, and we are a grassroots organization that was founded by people with prostate cancer in 1990. So we are one of the oldest prostate cancer organizations in the country and certainly around the world as well. We operate under the idea of someone to talk to who understands. The objectives that I have for our call today are to hear an overview of prostate cancer, both the incidence and challenges, and Rachel did a nice introduction for us early on here for us today. I want to identify those at risk, such as African Americans and others, and for you to learn about US2 as a resource for you in fighting prostate cancer. What is the prostate gland? Let's start there with some basics and what are some of the common problems. First of all, only men have prostate glands, but women are affected because of our relationships with women. There are our sisters and our mothers, our relatives, they are affected by the side effects and the impact of prostate cancer. My own wife, for example, her father died of prostate cancer, metastatic prostate cancer, and her ex-husband is also a prostate cancer survivor. That places her son, David, who is in his 40s, at risk for prostate cancer. That's one of those variables that we talked about earlier. If you have it in your family, the likelihood of it affecting you is there, and we need to deal with that. Prostates generally grow larger as we get older. So if your prostate cancer gets too large, it can cause other health issues, and we want to be aware of that. It's not just prostate cancer, but it's other issues with the prostate. It does not always mean you have cancer. The National Institute on Aging tells us about common problems that men face besides prostate cancer, and BPH, benign prostatic hyperplasia, means that your prostate is enlarged, but it's not cancerous. This is fairly common in older men. An enlarged prostate may make it very difficult to urinate, and it causes could cause dribbling after urination. You may feel the need to urinate a lot, often at night. So when we hear men talking about issues related to getting up during the night, that's an indicator that something is going wrong with the prostate. And again, it's normal that our prostates get larger as we get older. There are also other issues like bacterial infections, often called bacterial prostatitis. There is both an acute, meaning an intense, or a chronic situation that can result in infections. These are treatable. People need to visit their doctors. I mean, the good news is that these things are treatable. There's also chronic prostatitis, which some people call pelvic pain syndrome. So often men will talk about, I have pain, I don't know what it is. It may be a urinary tract infection. It could be what we're seeing here as prostatitis. So let me just click ahead here. Where is the prostate gland? And what is prostate cancer? You can see pictures like this on our website. So when people ask where it is, on the bottom right side picture, you can see that the prostate gland is part of the male reproductive system. It's located at the bottom of the bladder and just in front of the rectum. It's walnut size, so it gives you some sense of how big it is. And as I mentioned, it grows larger as you get older, and if it gets too big, the bottom line is it causes problems with urination and pain. It manufactures part of the fluid of the semen. Thus, it's a gland. You know, a gland is something that produces liquids in our bodies, just like our salivary glands in our mouth. Prostate cancer is a disease that affects the cells in the prostate. We know that cancer in general means that cells have started to grow in an abnormal way. And what we see in prostate cancer are actually tumors within the prostate itself. And what we hear about prostate cancer is it's often multiple tumors. Let me go to the next slide for us. So why is cancer an issue for us? Cancer is age-related. It places more of us at risk as we get older. We know from estimates about 12 million people living with cancer in America now. And added to this, America is aging, as is the world, and as the Administration on Aging tells us, by the year 2030, which seems a long way away, but really is only 15 years from now, there will be 72.1 million older persons. That's more than twice the number that existed in the year 2000. Plus, I like to think that we recognize that the post-war World War II baby boom generation is turning 65 now, so there's some sense of urgency that we're facing now. There's a rate of 10,000 people every single day who are turning 65. All of this means we're in a much more intense situation, or for some of us, we think this is a crisis. There's a lot more people at risk for cancer right now, and certainly cancer in general and prostate cancer in particular is an issue for aging. As we saw on Rachel's slide earlier, the older men get, the higher rate of risk for prostate cancer. CDC tells us that cancer kills 575,000 people a year. It's only second to heart disease, and all other causes of death are much lower than cancer. So why is prostate cancer an issue? 1 in every 2 men are at risk of getting prostate cancer during their life, or of getting cancer. So 1 in every 3 men, 1 in every 2 men are at risk of getting cancer in their life, and 1 in 3 women. So cancer is a common thing that we all have to live with. Men in general do not live as long as women do on average, so it's an issue for men in that we die sooner. Prostate cancer is the highest cancer that's diagnosed behind skin cancer for men. just like breast cancer is for women. So both are major and common cancers. Although progress is seen, it is still a fact that less is known in the general public about prostate cancer and the prostate than by the public about breast cancer. So we want to see much more awareness about prostate cancer. It's just not seen at such a high level as breast cancer is. And really that is a positive thing for the breast cancer community. And in fact, our name, us too, a little later I'll talk about, but represents the recognition and appreciation for what women have accomplished and the sense of purpose that we feel here about prostate cancer, that much more needs to be done. Why is prostate cancer an issue? I have a couple more slides about prostate cancer as an issue. The NCI says that there's more than 2.6 million men living with prostate cancer today. So that you remember there's about 12 million. So that's about 1 in 6 of the cases of the people that are alive with cancer today have prostate cancer. There is almost 240,000 people who are estimated to be diagnosed this year. And the death rate is also extremely high, again, as I mentioned, only second to lung cancer. The risk of having prostate cancer diagnosed overall for men is 1 in 6 during our lifetime, but as Rachel's slide showed, it's much higher as men age. So it's even higher than the general risk for women have, 1 in 8, for breast cancer. So when people are asked in the general public, they generally think women and breast cancer is much more high incidence risk than it is for men for prostate cancer. So that's one of the bullet points that we need to make here as we deal with people about cancer. As Rachel mentioned, African American men are also at a higher risk. In fact, their risk is 1 in 4. So this disparity is a major concern. Certain other groups are also at risk. Vietnam veterans, for example, are at risk. And people with family members are also affected at a higher rate. The CDC tells us that this is the second leading cause of death, cancer death, behind lung cancer. And it's the 4th leading cause of death of African American men over the age of 45. So it's a major issue for us, right behind heart disease, right behind lung cancer and stroke. So African Americans we need to be particularly focused on in our outreach efforts. Rachel mentioned several barriers to reaching this population and veterans. American men, of course, have some particular issues of mistrust, as do Vietnam vets. We know the Tuskegee experiment set the stage for mistrust by African Americans. And as we know, veteran service facilities are often mistrusted as well. So we have some particular trust issues that stand out for us that we need to be aware of in our strategies. I want to talk a little bit now about prostate cancer challenges that we see today. Early prostate cancer often does not have symptoms, and we need to keep that in mind. So often men, of course, think, well, I feel fine. Nothing's wrong. And men, of course, as we all know, try to always look strong, never admit any weaknesses. So when you don't have symptoms, it's hard to listen that, well, maybe I should go in and get tested. Often in the past, men were diagnosed with advanced disease, and one of our hopeful messages is that men often now are diagnosed earlier in the course of the disease, before the cancer cells have left the prostate and before it causes pain elsewhere. Often when prostate cancer becomes metastatic, the cancer cells migrate to our bones. So that, of course, means your lower spine and your what some people call the pelvic girdle. So bones often become the first site where prostate cancer cells go. And some people will talk about, well, my father has bone cancer, when in fact they have prostate cancer that's gone to the bone. And again, men do not talk as openly as women do. We try to be strong and silent. And so the cause of addressing prostate cancer for us has some different challenges than we see for women. For example, women often will identify with being a breast cancer survivor, where men really don't see much glory in being a survivor, and they'll talk about, I see myself as a warrior, and we need to sort of reframe the cause of prostate cancer to deal with men. Men often don't want to seek support. They want information to take action and make a decision. The PSA blood test resulted in a jump of men being diagnosed in the early 1990s, but that test is now controversial, and I'll talk a bit more about that in the next slide. But some fear that more men will be diagnosed with later disease, or they will be overtreated. So that is a challenge for us today in prostate cancer. Let me go back here. I think I went too far. Okay. So early detection now becomes more of an issue for us as we're all individuals are living in a confusing environment about screening. Maybe many of you have heard a few years ago in 2012, the U.S. Preventive Services Task Force and other organizations issued new screening recommendations for prostate cancer, and they recommended against screening for prostate cancer for the general public. And there's a great deal of controversy, and many people feel fear that men, especially African American men, will in fact use that as an excuse not to get early detection tests like the PSA. The PSA test, on the other hand, does have limitations. It is not a prostate-specific cancer test, and it may identify other prostate conditions, which is a good thing. As I mentioned, there are other conditions early on in my slides. The digital rectal exam, the physical exam, it's often seen as embarrassing, and it's avoided, or at best we joke about it as a way of dealing with the issue of a physician actually doing a physical exam, entering your rectum, and what they're really doing is feeling the prostate, because remember the prostate is there near the rectal area. There is a great deal of hope, and not just blind hope. We know more about prostate cancer right now and have better treatments than ever before that are available. So we really need to be positive. We live in a very positive time about prostate cancer. So I want to talk on this slide about what are some suggestions of what can be done. We can raise awareness, offer discussion and information about the prostate gland. Many men know little about their prostate. It's still often called the prostrate. My father was afraid of two things when he was an old man, and one, he always says, I'm afraid of that prostate cancer, Tom, and I'm afraid of old-timers disease. So Alzheimer's disease has come a long way, and in my introduction, Rachel didn't mention that I worked for a long time for the Alzheimer's Association. So as we've raised awareness about dementia and Alzheimer's disease, we are now at a period of raising awareness about prostate cancer. And a gentle reminder to people about prostate, the use of prostrate as a term is it's not uncommon. So you want to make sure that part of your message is that we're talking about prostate cancer here. Often we don't know where it is and what it does and how it can act up as we age. So a lot of what we really need to do is to raise awareness about prostate health, about men's health. The bottom line is cancer and prostate cancer is something we need to raise awareness about. If we are nowhere as visible about the blue ribbons for prostate cancer as we are for the pink ribbons that we see in October for women and breast cancer. Another suggestion about what can be done is to get women involved. Yes, women don't have a prostate, but they are directly affected by this disease. And we know that often in families that are affected by cancer, the members who do not have the disease in the family often feel high levels of anxiety and fear and are challenged by depression. And caregivers need and seek help and find support groups very helpful. And our whole concept here in Us Too is about empowering people to make informed decisions. And be sure and let women know that they are, in fact, involved here and impacted by this disease. I think another suggestion of what we can do is to form collaborations. Be aware of the barriers, the ones that Rachel mentioned in the beginning and the others that we see, that these barriers are faced by families. Again, the disease affects everybody in the family. Often we see people who have no doctor, and it's very common in men not to see doctors, and it's very common in men, in families for women to be the ones who arrange doctor appointments. So when we often say to men, see your doctor, be aware that often men have no doctor. They either have no insurance or they're underinsured. Often just transportation barriers or just plain old fear about I might have cancer, so I don't want to know. Be aware of community resources such as Us Too. Us Too has over 300 support groups that are led by volunteers in communities, and often in your communities those resources may exist. They're often looking to form partnerships. I'm here today because I believe partnerships and collaborations are important. Look for sources of information and outreach programs. We live in an age now with prostate cancer where there's a great deal of information. When we were starting Us Too in 1990, there was not much information about prostate cancer and not much we could do about it. And in fact, my wife's father died when he was diagnosed with his metastatic disease, and there really were no treatments for him at that point other than a clinical trial. And clinical trials are important for us to keep in mind for people as well. My next several slides really are about Us Too, to give you a sense of how we can be a resource to you. And let me just say, our unique name, Us Too, was founded because we were very impressed, our initial founders were very impressed with what was going on in the breast cancer area. And at organizing meetings, they really did have this sense of the battle is the same for Us Too, and the whole awareness and information that was prevalent with pink ribbons and issues of breast cancer awareness really are the same battle for men with battling prostate cancer. These initial guys our founders were all about learning to cope through knowledge and hope. So it really is about knowledge. It is about knowledge brings hope, knowledge brings power. Our mission was updated in 2009, but we really want to be the leading prostate cancer organization. We want to help men and their families to make informed decisions about prostate cancer detection, treatment, and we do this through support, education, and advocacy or awareness building. Thus, the whole concept for us of See Blue, all about support, education, and awareness. let me just drill down a little bit about what we mean by support, education, and advocacy. We have both online and in-person support groups where people can learn to be empowered. So 24 hours a day, people can find online support groups. They can see people in person in their communities in a support group. And men's support groups really are about learning from each other. They're not about complaining or whining about their disease. They are about learning to be empowered and informed. And to educate and support people, we have a monthly newsletter we call the Hot Sheet. We live in times of great information and breakthroughs, and we want to have the Hot Sheet provide that latest information. We do e-blasts, and we hold webinars like this one today. We have kits of information for people who are newly diagnosed or people who have advanced disease. We have books and literature here that we share with people at no cost. We have educational brochures and online information center where you can order information. We have collaborative websites with other people. For example, I list here my prostate cancer roadmap, which is available for people who have advanced disease. And our website is active, having over 5 million hits a year. So every day, people can call here on an 800 line, or they can come to the website and find information. We also are very active in advocacy, seeking federal funding appropriations for research. We nominate men to serve as reviewers of research. We collaborate with other prostate cancer organizations to do websites and to hold advocacy information. We sponsor petitions around core issues. We also raise awareness here in Chicago by doing a walk and working with others to provide awareness information. And let me just mention finally about us to a focus on our support groups and chapters in local communities. They are led by people who are directly affected by the disease. Sometimes they're sponsored in hospitals or cancer centers as well. And some are available to do awareness and fundraising events in their communities. The next slide I want to talk about other ways that we can make a difference together. First of all, I really encourage you to encourage others and to tell personal stories, to talk about prostate cancer and men's issues. We often forget that prostate cancer kills men, and it's second only to lung cancer in cancer deaths, as is breast cancer in women. We need to let people know that people die of the disease, but they need to be vigilant and active in their care because on the positive side, there is a great deal of new research and new products and treatments coming to market. Promote the color blue just like we do the color pink. It represents support and research efforts for prostate cancer. We see pink everywhere. Let's also match it with blue where we can. Have a positive message. Early treatment is available. We want to empower men and others to be the quarterback of their care, or as some people call it, being the CEO. This is about shared decision making that good physicians are recognizing is important. I often tell the story that in my mother's case, she had 2 cancers, and in her first bout of cancer, people quickly treated her and didn't involve her with many questions. 10 years later, when she had her second round of cancer, the cancer treatment world had changed. And they were asking her what she wanted and asked her to bring her family members in with her to the caregiving team. So we know that the way we approach healthcare and the way we approach doctors and patients and other healthcare professionals is different now. And we want to encourage people to be very active in their care and not to be hesitant at all to seek second opinions and to ask questions. Many of our information pieces have questions that people can ask. We encourage people to bring people with them to their doctor and healthcare team appointments because people often can't hear. They're so stunned that they can't remember what the doctor said. So I think it's also important about the way we can make a difference together is to refer people to us too and to our materials and to support groups, to make it okay for people to go and see a support group, to let them know it's not a place where they're going to have to listen to people whine, but it's a place where they're going to go to get information so that they can be empowered. And reach out to those at high risk, and that means African American men and Vietnam vets. And it's important to know, too, that many people, just because of the way we are more open now than when we were in the past, that many people don't know what cancers have existed in their families. They don't know that they're at risk. I want to go to the next slide, my last slide, about other ways we can make a difference together. Researchers are really studying and looking at possible reasons why African American men are at more risk, including culture and environment, and differences in biology and of the disease in African American men. Genomics have changed the way we look at cancers. We recognize that cancers morph and change, and as we treat them, they react to the treatment. So we know that any particular person's disease will look very different at one point in time than in the next. So there's a great deal that we need to do to encourage men to know that there's much more that is known than ever before, and much more they can learn, and encourage them to be powerful and involved in their care, as well as the other members in their family. Now, we also can be aware that September is Prostate Cancer Awareness Month, just like October is Breast Cancer Awareness Month. And what we're seeing much more is Movember, or November, beard and mustache growing activities for men's cancers like prostate cancer and testicular cancer are gaining momentum, and it's a fun way to make people aware of prostate and men's cancers by simply growing a mustache or beard. We saw Al Roker and others on the Today Show just last year in fall. You know, that's the kind of fun that you can have. We also have programs to raise awareness about craft beers with pints for prostates, and we're doing the same thing for wine tasting events, pours for prostates. These awareness events, whether they're runs or walks or special events, are ways that we can have fun. It's non-challenging, and it's a way that we can raise awareness. And those who want to help and raise awareness, it gives them an opportunity. We also have a particular brochure on our webpage that is a favorite of mine that the link is here on this slide. Even though it's in yellow, it's hard to read a bit. But that brochure, if we have anything that I think is a simple, easy brochure that you can put out, that you can use, please feel free to use this. It's called Special News About Prostate Cancer. It was designed and used during an outreach program that CDC sponsored here with us too. That was a special outreach program to minority and underserved men. We also have it in Spanish, and it covers basic information about who is at risk. It gives a cartoon cutout picture here of where the prostate is and what is prostate cancer. And it provides some simple information about us too as well. So if there is any one piece of information that I would suggest for you at us too, that's it. We also have a great deal of other information as well. So let me turn to my last slide, which is meant as a wrap-up and summary. Men and women need to be empowered to handle this growing health issue, and this prostate cancer is a growing health issue. We do live in a time where that's becoming more evident, We see mention of prostate cancer on TV shows and in more places now. But there's still a great deal of basic information that needs to get out there, and we just simply at us2 believe that not enough is being done. With the aging population, more men are at risk. There's the earlier we can make people aware, the better. This is a cancer in some men that is slow growing, and in some men is aggressive. It's an important personal decision. These times are very confusing to people. There are many people who have said you don't need to get a PSA screen for prostate cancer in the general population. But for African Americans and men at risk, there are no guidelines that are relevant. There are some new ones that are beginning to be disseminated, but let people know who are African American and who are Vietnam vets and men who have it in their family. They are at risk, and those PSA guidelines do not relate to them. They need to think differently. They need to be proactive. We have, and I have, a very strong belief that we have a right to know if we have cancer. It's important to let people know they have a right to know if they have cancer. And no one wants to be overtreated or undertreated. There is grave concern that people will be overtreated needlessly or treated too aggressively. And there are profound impacts on the quality of life for men, including their urination and including intimacy, the ability to have erections, and it will impact their intimate relationships with their wives and others, partners and others. And it's important that we know, in summary, that prostate cancer may or may not kill you. It kills a lot of people, only behind lung cancer. So it may not kill you, and there is no test right now to tell you if what we refer to as your cancer is a tiger, and it's going to be very aggressive, and it will possibly kill you, or if it is a pussycat, and it can be handled because we've gone from a period of watchful waiting to active surveillance. And there are new protocols, new clinical trials on how do we actively surveil this cancer and strike when it's the appropriate time and buy yourself some time and avoid some of the very challenging impacts of treatment. This cancer is not one to be feared, and avoidance is not going to help. We need to encourage people with a hopeful message that life-extending treatments are available. There is, and if the intervention happens early in the right cases, there's near 100% certainty that people will get rid of their cancer. There is no solid cure yet, and we still seek a cure, but people have to monitor and adapt. People need to change their lifestyles and adapt. They need to be on top of their cancer. People need to hear the message that they need to be a warrior and that you have value. Often men have been trained, and let me wrap up by saying this. We've been acculturated and trained that a good man is a self-sacrificing man. Our heroes are men who have given the ultimate sacrifice in uniform, and they've given their life for others. Men want to be heroic, but men need to hear the message that we often hear on the airplane. You have to put the oxygen mask on. You need to take care of yourself first in order to help others. And it's heroic not to avoid the disease, not to avoid screening and testing. That's not macho. That's not heroic. What is macho and heroic is to take care of yourself so that you can be available for your family, your children, and your grandchildren, and those you love and care about. So I will wrap up there, and I want to thank you for listening to me. I know we'll enter a Q&A period, and here is where you can find our 800 number and our web address. So thank you very much.
Thank you so much, Tom, for your very informative presentation and the wealth of information and resources you provided to us. And what an excellent way to end the webinar by saying that, yes, men need to take care of themselves so that they can be around to take care of their families, their loved ones, and continue to live a life of quality. And so we'll go ahead and open up the Q&A session. Let's see. There we go. So in order to ask a question, just type it into the box that should be attached to the GoToWebinar toolbar. And you can ask your question that way, and we'll get it over to Tom, and he can have the answers. While we're waiting for questions to kind of pile up in the queue, I have just a few brief announcements. When you exit the webinar, you'll be prompted to do a post survey. Please fill out the post survey. We use that information to tailor our webinars to our attendees. So it's very informative and helpful for us. Also, here are additional resources about prostate cancer, including the U.S. Preventive Task Force recommendations for screening, as well as resources about African American men and their families. So you may want to just check those resources out very briefly. Also, visit our website at healthandaging.org for more information on free forms of training and technical assistance that we offer. And also consider joining our mailing list. We send out information about webinars, funding opportunities for health centers, as well as other programs, best practices, and evidence-based programs for aging populations. So feel free to check that out. Follow us on Twitter. We tweet quite a bit and provide our followers with information on upcoming events, webinars, some of the new recommendations and policies that are available, as well as just health-related information in general. Also, June 9th of this year, just in a few months, we'll be having our National Primary Care Symposium on Aging in Alexandria, Virginia. So we welcome everyone to come out and attend. It will be a very informative session featuring some of the best practices, some of the recommendations and strategies for healthcare providers and senior health advocates on outreach, enrollment, and community partnerships, with a huge focus on community partnerships. And then please feel free to contact us at the National Center for Health and the Aging. We provide, as I said, free forms of training and technical assistance, as well as our symposiums. So we're just a resource for health center programs and for senior health advocates in general. So we'll go ahead and open up the Q&A session. Starting off, there's about 2 questions about metastatic cancer, and one person asked, doesn't the cancer actually spread over the entire body, or doesn't have the possibility to spread over the entire body because their friend had it removed from inside his skull and throughout his back, but he was diagnosed with prostate cancer?
Yes, is the answer. It does spread through the entire body. And prostate cancer is most notably known, I guess, for that it will often go to your bones. And as this questioner asked, yes, that includes the skull. And what the good thing these days is that men are often diagnosed earlier in the disease. The other piece of the good news is that the earlier we seem to intervene, the better. There's a variety of different approaches, everything from lowering your testosterone levels, which is actually in 1966, a physician was awarded the Nobel Prize for finding out that if you lower your hormones, your androgens, your testosterone, that will slow down the cancer, the prostate cancer, because prostate cancer in essence feeds off of your testosterone. So lowering what's called hormone ablation therapy often helps slow down the disease. But there are other newer treatments as well for men with advanced disease. These are very current developments, very exciting. I was just at a conference this weekend where we were talking about several other things that are in the pipeline that are very exciting. And in fact, there was recent approval of radium-223, which actually now is specifically targets mets within people's bones. So we have some great options for people, and it's important that people keep looking and searching for new options.
Thank you. And also, just a side note, I forgot to announce that the slides and the presentation will be available on our website and sent to all the attendees after the webinar. So just look out for that. Also, continuing with the treatment, what are the most effective therapies out there for prostate cancer?
There are quite a few of them, and I think one of the replies I heard from a long-term warrior with his prostate cancer said, well, you can either lower the hormones, which we just talked about, and there's a lot of different ways that hormone ablation therapy can happen, and there are some newer products, so that's one way, is to hormone ablation therapy or androgen deprivation therapy itself. And people need to monitor their side effects from that because it places people at risk for heart disease, it lowers muscle level, it raises fat level, and there are behavior side effects that people often feel more tired. There's radiation therapy, there is surgery, and there's a variety of each type. There's robotic surgery, there's different types of radiation. So it's often complicated when people start to seek, well, what's the best therapy for me? And what is very prevalent in prostate cancer and a little different in some of the other cancers is that urologists are the men that you usually see, the doctor you usually see when you start to have prostate-related issues. Urologists are trained as surgeons, so often people will be sort of directed to surgery when they're early on in the disease, and then often robotic surgery, which is less invasive. So often it's not until a person has a bit more metastatic or advanced disease do they actually get to see an oncologist. So all of those issues make it difficult and confusing. So men will need a great deal of support and encouragement. Their family will. They'll need to seek second opinions because often urologists are not people who deal with either chemotherapy or radiation. So that sort of unique bundle of seeing different doctors gets to be difficult for people. And again, many men with prostate cancer live for a long period of time, for decades, and they will be not only have surgery, they'll have radiation, they'll have androgen deprivation therapy in many different forms for many periods of time. So there's no quite real simple pathway that often people follow. And it's often, men have great hope that, well, I had surgery, I had it removed, and I hope it doesn't come back. And the PSA test is just a screening test. It is not the way prostate cancer is diagnosed. It's generally diagnosed with a needle biopsy through the rectum in most cases. So there are at least 1 million men a year that have a rectal needle biopsy and the cancer is not found, and yet their PSA continues to rise, and they find themselves going back for multiple biopsies until they actually finally strike one of the tumors. So I hope that wasn't too long of a reply.
No, that was perfect. So yeah, moving now into the flip side. So we talked about the therapy. So moving now into prevention, are men who take testosterone more prone to have prostate cancer? Yeah,
that's a great question. We don't know the answer yet. But there's suspicion that, yes, it does place you at a higher risk for prostate cancer. Again, as I mentioned earlier, the tumors, the disease, the cancer feeds off, the cells feed off of testosterone. We think that the trigger for the disease is genetic related. So whether or not, we don't know enough yet about the genetics of the disease to tell you if you are at risk by increasing your testosterone. But it certainly is also, we see a great marketing going on right now about low testosterone levels to men in their 40s and 50s. But I have not seen any definitive research to tell us an answer to that one, if you in particular are at risk yet. So that takes us back to the importance of being in charge, being active, monitoring your health care. If you're going to a doctor who's giving you testosterone, you better make sure you're either seeing him or another doctor to have your PSA tests monitored as well, because it could put you at risk. And if you are in a highly susceptible at-risk population, like African Americans or men who have it in their family, you sure want to make sure you're monitoring for that danger.
Mm-hmm. And are there any rapid test or screening methods available?
For prostate cancer?
Yes.
Well, we rely on the physical exam, the doctor actually inserting, a gloved, lubricated finger and feeling the backside of the prostate. So if he's feeling for tumors or rough spots, and that's uncomfortable, and many men want to avoid that. And there's a lot of jokes about that. But we've relied on that test for a long time, and it has its weaknesses because the doctor can't feel the whole prostate. And the prostate, unlike breast cancer self-exams, your breasts are on the outside and you can get to them easy. That's not the case with your prostate. Now the PSA test is the blood test, which has been around for a long time, and it's quite controversial. It's not specific to cancer. There are some newer tests. There's a urine test, which are coming on the market, which are worth asking about, that are prostate cancer specific. They're often not covered by insurance, and you need to find out the cost. And researchers are looking for new tests that are prostate cancer specific. And so there's a lot of work to be done yet, and it's not an easy, simple answer.
Yeah. Okay, great. And then you mentioned the PSA test. How is it controversial now?
Well, first of all, it's not specific to prostate cancer. So it's just going to tell you that the PSA, the prostate-specific antigen in your blood, is higher, and you need to monitor it over time. It also may tell you you're at a normal level, but you have a form of prostate cancer that doesn't necessarily raise your PSA. So you could have prostate cancer, and you could get told that your PSA is in the normal range and not to worry, and in fact, you really do have prostate cancer tumors. And what we know from autopsy is that most men have prostate cancer tumors in their 30s. Now, again, we don't have a test that will tell us if those tumors are benign and they don't really matter, nothing bad's going to happen, or if they're aggressive ones. And those are the kind of tests that we're looking for and get on the market. The other problem with the PSA blood test is that sometimes guys will get that screen alone and then not get the physical exam. And so it's unreliable, it's often inaccurate, but it's better than nothing. You shouldn't avoid it either. And in older men, we don't necessarily know. Older, I mean, if you have like on the charts, if you're in your late 70s, for example, maybe in your 80s, and you have less than 10 years to live, having a PSA test is probably not going to help you much.
Yeah, that's very true. And how do we address the sexual health needs of men living with prostate cancer?
that is a whole area of a lot of support. There are a lot of good books, information. There's a website that we have here that helps with those things. It's called Inspire. You can find it on our website. There's a specific area where people can talk to each other and learn from each other about intimacy issues. It's very difficult on relationships, whether you're straight or gay. There's just a lot of emotionality around this. There's a lot of fears. So people need to seek assistance and help, and there's books to read. There's a lot of good information out there. People just need to drill down and find that kind of information. And if you're working with people who are addressing this issue, you may need to do some homework to find good information to give folks. People need to be listened to. Therapists are around, counselors are around who can help talk about relationship issues as well.
Yeah. And continuing with that, like the relationship, the family, are there therapy sessions for families and caregivers to just include everyone who will be affected by the disease, and what models are those, if you know any?
Yeah, well, I think support groups are good for that. Many of the support groups have special sessions for women and partners. There's a lot of books around here and elsewhere that people can look into. Some of them are written by therapists. There are even therapists that I've met along the way who specialize in working with people with prostate cancer. They've done webinars and sessions, have written books. So those people are out there. It's just a matter of finding them.
Yeah, okay. And the last question, please tell us more about the urine test, what the name is, and should we be asking that this test be performed?
It is worth suggesting, yes. And it really depends on a person's position to a large degree. Let me see if I can real quickly find the urine test. You can find information about it on Wikipedia, of course, just by putting in prostate cancer. And I saw it earlier today. I didn't write it down, however. Some specialty clinics use it a great deal. It's probably best known as the urine test. It has a letter and number to it. I'm trying to see if I can find it here quick to give you an answer, but it's not showing up quickly, easily for me.
Okay. Well, we can get that information to the attendees and try to send that out with the slides that I'll send out once we find out what the name of it is.
Great.
Yeah. And so I would just like to thank you again. Thank you everyone who attended, and thank you, Tom, for joining us today and providing the information, resources, and tools to help us better serve populations who are at risk for prostate cancer. And to everyone, the PowerPoint slides and the presentation will be sent out shortly after the webinar and included on our webpage. So if you need anything, please feel free to contact me. My contact information is listed at the top. And thank you again, Tom.
Oh, it's my pleasure. And I hope it was helpful to people out there. Feel free to shoot me emails as well, and I'll get that urine test over to you as well, Rachel.
Okay. Excellent.
All right.
Thank you. You have a good day.
Okay. Bye for now.
Bye.